Hi, my name is Emma. I'm going to be your nurse today. I'm going to be performing the head, eyes, ears, nose, and throat exam. Can I have your name and date of birth?
Audrey Fish, January 28th, 2005.
Perfect. That matches with the bracelet. I'm going to perform hand hygiene. And I'm just going to make sure that the room is private. Okay, so first I'm going to start by looking at your face for symmetry so I can see that your eyebrows, your eyes, nose, and mouth are all symmetrical. Now I'm going to palpate your scalp. Let me know if you feel any tenderness.
Nope.
Okay, no tenderness, and scalp is normal cephalic. Alright, so now that I've done that, I'm going to palpate your TMJ, so just open and close your mouth for me. Okay, there was no clicking and it was smooth movement. Now I'm going to palpate your temporal arteries. Okay, that was smooth, no hardness. Now I'm going to auscultate your temporal arteries. Okay, no bruise noted. Okay, no bruise noted. Okay, now that I've done that, I'm going to palpate your sinuses. So let me know if you have any pressure.
Nope.
Okay.
Nope.
Okay, so no frontal or maxillary pressure. Now that I've done that, I'm going to assess cranial nerve number 5 trigeminal, and this is for sensory and motor. So just crunch your teeth for me. Okay, motor is intact. And now let me know when you feel this cotton.
No. 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 No.
Perfect. Cranial nerve number 5, trigeminal, sensory, and motor is intact. Now I'm going to test cranial nerve number 7, facial, so just raise your eyebrows, close your eyes really tight, purse your lips, smile, and frown. Okay, cranial nerve number 7, sensory and motor, facial is intact. So now that I've done that, I'm going to inspect your neck. So your neck looks symmetrical. There's no bulging veins, no signs of JVD. Your trachea is midline. Now I'm going to have you lean forward and down for me. Palpating the thyroid, there's no enlargements or nodes. Other side? No enlargements or nodes. Okay, great. Now I'm going to palpate your lymph nodes. So I'm going to start with preauricular, posterior auricular, occipital, superficial cervical, deep or anterior cervical chain, posterior cervical chain, and then supraclavicular, just go like that for me, supraclavicular, okay, tonsillary, submandibular, and then submental. There was no inflammations or enlargements noted. So now I'm going to assess cranial nerve number 11 accessory. So just push up on my hands. Okay, and then push on my hand. Push on my hand. Okay, great. So cranial nerve number 11 accessory was intact. Patient responded to resistance. Now that I've done that, I'm going to do hand hygiene. And I'm going to put my gloves on. Okay, so I'm just going to start by looking at your nose. It looks symmetric with the rest of your face. Let me know if you feel any tenderness.
Nope.
Okay. Now grabbing my otoscope. I'm going to have you look up for me. So looking in the nair, I can see that the turbinate is pink in color. There's no redness or inflammation. Same with the other side. Turbinate is pink in color, no inflammation or redness. Okay, now that I've done that, I'm going to look at the lips. There is no excessive dryness, lesions, or cracking. Tongue pressure. You open Looking at the buccal mucosa, there is no lesions and it is pink and moist. Go like this with your tongue. Floor of the mouth, again, there's no lesions or redness. Put your tongue down. I'm going to look at your teeth and the gums. Teeth are white. Gums, no signs of gingivitis or inflammation. I'm going to have you stick out your tongue. Looking at the lateral borders, there's no signs of leukoplakia. Now I'm going to have you stick out your tongue and move it side to side. Okay, that assesses cranial nerve number 12, hypoglossal motor. Patient was able to move tongue side to side. Now I'm going to have you open your mouth and say ah. Ah. Okay, that assessed cranial nerves number 9 and 10, glossopharyngeal and vagus for sensory and motor, the soft plate rows. Alright, one more time. I'm going to have you open your mouth, stick your tongue out. Looking at the tonsils, they are pink in color and they have a grading of about 1+. Okay. Now I'm going to doff my gloves and perform hand hygiene one more time. Okay, so now I'm going to move to your eyes. So looking at your eyes, I can see that all your eyelashes are intact. I can see that your iris is even in color and your pupil is round. Your sclera is also white. It burns, sorry. Okay, I'm gonna have you look up. Conjunctiva is clear and then bottom conjunctiva is pink. Now I'm going to palpate your lacrimal gland. Any pressure?
Nope.
Okay, and lacrimal gland has no pressure. Alright, so now that I've done that, I'm going to move to testing optic nerve number 2, or cranial nerve number 2 optic, and this is sensory. So I'm going to have you cover your eye, and then hold this card out, and then read the first line.
2843.
Okay, then switch hands.
2843.
Okay, perfect. Hold on to that card. So optic, cranial nerve number 2 optic, sensory was intact, and now assessing cranial nerve number 2 again. I'm going to have you cover your test. This is going to be the peripheral with confrontation test. So I'm going to cover the same eye, and then let me know when you see my fingers.
No. No. No.
Okay, now switch.
No. No. No.
Perfect. Okay, I can take that card. Okay, so that was testing also, again, optic nerve number 2 sensory, and that was intact. She saw all my fingers when she needed to. Okay, so now I'm going to move on to assessing cranial nerves number 3 oculomotor, 4 trochlear, and 6 abducens. This is all motor. So first I'm going to start with the corneal light reflex. So I'm just going to shine this light. Okay, the reflection was symmetrical. Now I'm going to do the cover test. So I'm going to have you hold this on one eye, and I'm going to have you look at the door and then remove the cover. Okay, the eye had no deviation and was fixed. Let me do the other side and remove it. Okay, eye had no deviation and was fixed. Alright, perfect, I'll take that. Alright, so now that I have done that, now I'm going to do the 6 cardinals and test for lid lag. This again is for 3, 4, and 6. Okay, so just follow my finger and don't move your head. Okay, movement was smooth and there was no sign of lid lag. Now that I've done that, I'm going to turn off the lights, and now I'm going to test for direct and consensual constriction. Okay, the pupils had direct and consensual constriction. Pupils also had direct and consensual constriction. Now I'm going to test for accommodation, so just follow my finger in. Okay, there was symmetrical following of the pupils, so now I can say the pupils were equal, round, reactive to light with accommodation. Alright, so now I'm going to move on to testing with my ophthalmoscope. Okay, so I'm gonna. Alright, so first moving in, I should see the red reflex. Then I'm going to move in a little bit farther, and I should see the optic disc, which should be yellow and orange in color with no edema and no hemorrhages of the vessels. Do that to the other side. Again, I see the red reflux, and then moving in, the optic disc is yellow-orange, no edema, and the vessels are not constricted. Okay, so now that I've done that, I'm going to do hand hygiene again. Now I'm going to move on to your ears. So I'm just going to start by palpating the pinna and the tragus. Any tenderness?
Nope.
Okay. Any tenderness?
Nope.
Okay, so no tenderness in the pinna or the tragus. I also see no lesions, redness, or inflammation. And again, no lesions, redness, or inflammation. Now I'm going to take my otoscope again, and I'm just going to insert this into your ear. So I'm going to pull the pinna straight up and back. Okay, looking into your ear, I saw no excessive cerumen and also no foreign objects or foreign bodies. I can also see that the tympanic membrane is gray with the presence of the cone of light. Again, pulling the pinna up and back. Okay, there is no excessive cerumen, also no foreign bodies. The tympanic membrane is pearly gray with the presence of the cone of light. Okay, so now I'm going to do some testing on your ears. So first I'm going to start with the whisper test, and this is testing cranial nerve number 8 vestibular cochlear. So I'm going to have you cover this ear, and I'm going to whisper 3 things and just repeat them to me. Bell, blue, tree.
Bell, blue, tree.
Okay, and then cover this eye. Gray chair bottom.
Gray chair bottom.
Okay, perfect. That cranial nerve number 8 vestibular cochlear is intact. She repeated all the words correctly. Okay, now I'm going to move on to the Weber and Renee test. So I'm going to start with the Renee test. So let me know when you stop hearing the sound.
Okay. No. No.
Same thing.
No. No.
Okay, great. So the air conduction was twice as long as the bone conduction, so that was good. Okay, now I'm going to do the Weber test, so let me know if you hear this in both ears or one ear better.
I can hear it in both ears.
Okay, perfect. Okay, so now I would clean up my equipment. I would do hand hygiene again. Any questions?
No.
Okay, thank you.